All right, hi everybody. So we're here with Danny today, and we're talking about testosterone pellets with BioTe. So I'd love for you to tell our listeners what made you get pellets to begin with. How were you feeling before you started getting your pellets?
So before the pellets, I actually did the injections for a little while.
Okay.
I was having trouble sleeping, mood, not only physical mood, but in the mood to have with my wife.
Sure.
So
your libido.
Yes, exactly.
Right.
So we did some of the injections for a while, but it was kind of like a roller coaster with the injections. It was good for a week, and then I would crash, and it was back. So we kind
the steady state was not being achieved.
Yes.
It was up and down.
So it was more of a roller coaster where it was good, bad, good, bad, good. Not necessarily bad, but I could feel the difference, the tire.
Yeah. Yeah.
So we researched the BioTe, which was more of the bioidentical to the hormones that your body produces.
Correct.
And so this will be roughly my 7th or 8th time getting the pellets.
And that basically tells me that it's working well for you because you want to keep doing it. So the benefits, and you know this, but just for the advantage of the listeners, the benefits with, first of all, testosterone replacement is as we age, and usually with men, we all have heard of the term menopause, right? Now this is menopause, like andropause. There's actually a term for it called andropause, and that's when the testosterone levels for men really decline, and oftentimes this happens around your 40s, but sometimes it can happen earlier or later. But again, it's all about optimal levels. So when you get your testosterone checked, which I really believe that just like I promote that for women to get their hormones checked, I really promote that for men. So good for you that you started doing that at an earlier point to see what was wrong and why weren't you feeling your best. The level that you can actually see on a regular lab test is between 300 and 1100. Now imagine the range, right? When you're younger, you're used to your testosterone being between 800 and 1100. Now, if you go to sort of just a regular physician who's going to check your labs and say, oh, well, you're still in the range because you're at 350. Well, you feel very different at 350 than you would at 1000 or 800, right? So that's when you know, but hey doc, and I would advise everybody out there to be your own advocate and say, I don't feel like myself. I would like to have more energy. I'd like to have better libido. I'd like to have clearer thinking, right? You don't want to deal with brain fog. You want to have more motivation. You want to have better muscle mass. So testosterone is not just about libido. Testosterone is about feeling overall well. And studies out of Harvard and Johns Hopkins and many such institutions have actually shown that it's good for heart disease as well. It actually decreases your chances for heart disease. Now, I always say, do things safely, effectively, and carefully. So I always recommend bioidentical testosterone as compared to just, synthetic stuff. Number 2, make sure that everybody's looking at their PSA, and also not just looking at total testosterone, but free testosterone. And that's what we have looked at for you is total and free testosterone. Make a note of the PSA levels and make sure we're following that on a regular basis. So when you do get your testosterone pellets, how does it feel? How do you feel when you feel like your levels are good?
It's night and day.
Night and day.
They feel like I'm 25 again.
And I'm sure your wife likes that a little bit. That's great. So besides the libido, tell me what other symptoms you feel like are better.
I sleep better. One of the giveaways for me was stomach fat. I started getting a little pooch.
Such an important point.
And when the testosterone levels came back up, it was easier to kind of slim that out again, where I felt that struggling before.
Yeah, so your metabolism's better too.
Oh yes.
Yeah.
Yeah, so it was mood, like I said, the metabolism, the libido. I would recommend it for anyone. If you're struggling, if you feel tired or whatever, get tested, because it was, like I said, night and day for me. And I can tell I'm about 6 months out.
Yep.
And so that's about the time, and I can tell, and my wife can tell when it's time.
Not where it needs to be.
Correct.
And you're a dad.
Yes.
And how does it make you as a dad, as a husband, as a professional? Like, what does it do to your life?
For me, I can tell my patience.
Yes. You're not as irritable with the kids and your wife.
Exactly, because I coach Little League as well, and so I can tell even just with my son and with the kids when I have to watch myself because I'll snap a little quicker, and it's hard to stay as focused as I normally am.
The irritability scale is a little higher when you're not balanced.
Yep.
So thank you for your time. We're going to be doing the actual procedure in just a few minutes. When we get all set up, we'll be back on Facebook Live to show you how easy the procedure can be. It's not that difficult and it doesn't take that long, but of course it is a minor procedure. We use sterile techniques and voila, you're gonna feel great. So thank you. See you soon.